Evening, David.
Hi, Mark.
How much damage did you have?
Oh, you can hear me?
I can hear you.
Okay. I, enough that I've been running around like an idiot. No electric for 2 days and damage to my barn, and I'm just now getting in. So be patient.
That's fine.
I'm not ready. I'm not ready for the class.
I was worried if you had
It's been a difficult trial.
I bet. I was worried you
Oh,
had some damage.
we came out a lot better than most.
Good.
We came
Good,
out a
good.
lot better than most. We know several people that got killed, and
Hmm.
uh, Wayne County had it's really bad. So yeah, trying to keep a good attitude.
Hi, is that Mark?
Yes, I'm here.
Hi, nice to meet you. I'm Abby.
Taking care of something real quick before I can turn my camera back on
No problem.
or talk to you. Okay. Mhm. Mhm. Okay, there we are. Let's see here. And then I need to share. Okay, I think I've got it set up for screen share for you for Abby.
All right, let me give it a shot. I'll see if it works.
My settings say it is.
Okay. Yep, it looks like it's gonna work.
Yay!
Okay, can you see it?
I sure can.
Okay, perfect. I'm just trying to get my kids out just a second.
You're fine.
Okay. That's the only downfall of doing it virtually.
You know, I'm waiting for my kids to holler at the cat.
How long have you worked with CASA?
I'm coming up on 6 years.
Okay. And are you a social worker?
No, I'm not a social worker.
Okay.
So basically, my job is volunteer coordinator. So I work to recruit, train, and support community volunteers who go out and visit with kids that are in foster care.
Okay.
So my minor was in sociology, which helped me get the position. But my job is basically to recruit more volunteers to the job and just support what we have.
Great.
But I do see a lot of the cases as well. I work a few personal cases, so I know what the volunteers are going through.
Right. Okay, great.
No, I credit Dr. Radu for helping me get the job here. Yeah, coming up on 6 years.
And how did you get connected with like our school? Are you friends with Dana?
Dana had presented last year for us,
Okay.
and I had sort of met her when they had done a social workers presentation at the University Center a couple of years
Okay.
ago. So I thought we'll reach out and see what you all can do for us. And
Yeah.
she said, "Yeah, let's go for it."
Yeah, yeah. I was so cool that we all got to do one for you, you know? And then Kathy was telling me today that a while back, because I know that Dr. Wiggins and then me and then Dana,
Right?
uh, we've done it this year, but then she was telling me she did it in the past. So,
Yes, she did one on the benefits cliff.
right.
Yeah.
Do you want me to start right now at 6?
No, let's wait just a couple more seconds to see if anybody else shows up, because surely we should have a few.
Yeah, because we just got someone.
Yeah. It's such a pretty day outside. Maybe they're all outside this evening.
And then, but you record it so that they can go back and watch it, right?
There are a few that will not be able to watch this evening. So yeah, there will be some that will watch the recording. And I make them do extra work to show that they watched the recording. Give it one more minute. Mhm. Well, it's a good thing you have sheep, David, and not cows. Because
Why is
cows go
that?
flying. Because cows go flying through tornadoes. Sheep don't.
Okay. That's
Wizard of
interesting.
Oz, you know.
All right. Well,
Okay, well,
oh, okay. I'm
now
sorry.
you
It's
get
been a long day.
it. Yeah.
I've got some beautiful lambs, so that's all I know. I don't like cows, so
Okay.
I like ribeyes.
I haven't had one in a long time. Okay, so we're going to go ahead and start.
They're too expensive.
Yeah. So this evening we have a presentation on trauma in children, and we have Abbie Nelson. She is a LCSW and a PhD from SEMO, and I'm going to turn it over to her.
Thank you. I'm excited to be here. And first of all, I just wanted to thank you all for your work because I have practiced in Guatemala, Mexico, um, in which they didn't have CASA volunteers. And then I have practiced in Texas, Michigan, Tennessee, and then now in Missouri. And every place I've been, like I've always had clients that have had involvement with CASA and have, it's just been a super support, a great extra thing for the community and of course for the individual kids and their families. So that's kind of my connection and why when, Mark reached out and asked, I was like, yeah, of course, because, you all are such pivotal parts to our community and to this vulnerable population. So I just wanted to first start out with that and say thank you. And then a little bit about me. I moved to Missouri in August to start working as a professor at SEMO. But prior to that, I have 18 years of clinical experience in social work. I've worked in community clinics. I've worked in other countries in nonprofits. I've worked on the border because I speak Spanish as well. So I've done a lot of like cross-cultural work with a variety of different populations, children, families, couples, kind of all the things. But then I also have a specific specialty in domestic violence and sexual assault. So I've dealt with a lot of families and a lot of children that have had trauma. A lot of foster kids, have come across my in a variety of different settings that and how do you say like phases that they're at in the foster care process, right? Because there's different phases that they're at. So that's kind of my own. I'm also a childhood survivor of trauma, and I still deal with the impacts of that today. So that's one of the reasons why I'm also passionate about understanding childhood trauma because it, affects you as an adult as well. And then I'm also a mother of 2 toddlers and trying to help those 2 not get traumatized, right? Which is challenging in this world that we live in where there's so many things coming at us. Oh, and happy St. Patrick's Day. I put that visual there because it's St. Patrick's Day and I've got my, sparkly headband to just bring us a little joy here. Okay. So what are we going to do today? I'm going to talk about childhood trauma, a little bit about the statistics. What are ACEs? And I know some of the adverse childhood experiences, and I know some of this you all have had training on. Impact of trauma, how it affects the brain, what we can do to help, childhood disorders that might be related to trauma, a little bit about attachment theory and resilience, and then we'll have an activity at the end. So I first just wanted to get a feel from you all. What do you, if you could kind of just name, what are some things that you already feel like you know about childhood trauma and with the population that you work with?
Well, in our basic training, pre-service training, we'll talk about trauma being acute, chronic, complex, and historical.
Great. Yep. Okay. Right. And the kids you work with face all of those, right?
Yes, yes.
Okay. I think the 2 people that just joined aren't muted. There we go. Okay, because I was hearing a little bit of feedback. All right. Okay, so what is child trauma? It refers to a scary, dangerous, violent, or life-threatening event that happens to a child between 0 and 18 years of age. And the National Child Traumatic Stress Network defines it as child traumatic stress occurs when children and adolescents are exposed to traumatic events or traumatic situations that overwhelm their ability to cope. So not all difficult experiences become traumatic. So you could have 2 kids that face a similar experience, but the support that they get around that and how they perceive the event is going to determine whether it becomes a trauma to them or not. And that's where in this context, you all come in because you can really help these kids have a difficult experience, but with the extra support you can provide, you might be able to help it not turn into a trauma. So the Substance Abuse and Mental Health Administration, SAMHSA, also explains it that the 3 E's, that you've got to have an event, so a threat or actual experience of harm, which may occur once or multiple times to the child. But then how does the child perceive that event? And that's the experience of it. So kind of asking the question, could the event have changed the way that the child feels about the world, others, about them, and about themselves? That's kind of a question we can use as adults if we're trying to figure out, has the child been traumatized by this? Because depending on the age, a lot of kids don't have the language to say, oh, I've been traumatized, but we can still look for these effects. And then the effect, what's the impact the event and the experience had on the child? And these can be short-term or long-term or both. So it may come up immediately after something occurs, or it could show up later. So this is just kind of another way to explain it. There's a distressing event early in life, and then if there is a lack of emotional support, coping skills, and a safe environment, then it will become traumatic. And these 3 things, and we'll talk about this as we go through the presentation, emotional support, coping skills, and a safe environment, you all can be a part of helping children with and are a part of helping them. There's different categories of childhood trauma. So there's direct, that's typically what we think of, right? You experiencing harm or abuse or a physical injury or something like that to someone, direct. Then witnessed, so observing disturbing events. You know, if children grow up in a home with domestic violence or just a lot of tension, a lot of fighting, these kind of things, then that can be very disturbing to observe that. Deprivation, so are they lacking crucial support or care? Research has shown that neglect can have an even more damaging impact on the brain than just direct physical abuse, because it's harder for the brain to kind of understand what is happening. And they're not even when they're abused directly in a way, they're getting some kind of attention, even though it's negative attention. But when they're neglected, it's like a complete dismissal of who they are, which is why the research shows that can be even more damaging. And then external, so facing forces beyond the family's control. Typically, we think about like natural disasters. You know, we just had in our area, but of course worse in the surrounding areas, the tornado, and people died, and you know there were children probably involved in some of that stuff, right? And so that's one that we recently had in this area. So this is one that Mark mentioned. Acute being those the traumas that are happening like right away and in the moment, and you're going to have the symptoms happening after the trauma, and then you've got or happening once or multiple times, but kind of in a short amount of time span. And then chronic is over time. So developmental trauma, you know, just growing up in an abusive home. Hidden traumas such as poverty, racism, homophobia, those are going to be more chronic because they're experiencing these oppressions, which is chronic in their environment every day, and that's going to cause a lot of trauma. There's big T traumas, and those are the things like if you were to just, you know, survey a group of people that haven't had trainings about trauma, and you ask them like, what is trauma? The big T ones are what people would typically say, like physical, sexual assault, natural disasters, severe illness, injury. And this is when someone has too much all at once or something that occurs for too long. But then you also have little T traumas. So it might not be like, you know, a tornado in the front of their face, but it's parental conflict on the daily. Chronic stress because of financial difficulties, work pressures, relationship struggles that are happening, or being repeatedly criticized, bullied, these type of things that are more chronic and are considered more of the little T traumas. And again, for it to be a trauma, so one child might experience a natural disaster and it doesn't feel traumatizing to them if they have the support that they need, but then someone else might. So we've got to, you know, be able to screen through that. So is this a big deal? The two national organizations, which you guys have probably talked about in some of your other trainings, are the National Child Traumatic Stress Institute and then SAMHSA, which I talked about earlier. And they have, a lot of the national statistics that they've gathered on childhood trauma and really great information that I have in the resources. But statistics from them state that more than 2/3 of children have reported at least one traumatic event by the time they're 16 years old. And with something like trauma that is kind of hard to express and can be very painful, we know that the statistics are just like abuse, like the statistics we have on abuse are not completely, they're more than are actually reported, right? So this is 2/3 that are reported, so there's likely more. The national average is 9.1 victims for every 1,000 children of child abuse and neglect. 1 in 5 high school students are bullied at school. 1 in 6 are cyberbullied. More than half of US families have been affected by some type of disaster. 19% of injured and 12% of physically ill youth have post-traumatic stress disorder. And we'll talk about what PTSD is in a little bit. So we can see it's a big problem, right? It's happening to a lot of kids all the time, every day. And so the adverse childhood experiences, so ACEs is typically what you'll hear people call it. This is a big study. It's an ongoing longitudinal study that's been going on now for a while to really look at if children have these different types of traumas happen to them: physical abuse, physical neglect, household member who has suffered from mental health issues, sexual abuse, loss of a parent due to death, divorce, or abandonment, emotional abuse, emotional neglect, someone in their house that's addicted to drugs or alcohol, someone who's incarcerated or witnessing domestic violence, particularly against the mother, is what they're seeing in the research. That these experiences have been linked to long-term consequences in the adults. So that's why it's kind of a longitudinal study. So they follow kids that have had these and are able to determine how these early experiences, if not dealt with appropriately, if not given the right support, can lead to risky health behaviors, chronic health conditions, low life potential, and early death. So this was a huge, important study when it comes to trauma and has really helped the trauma research community and clinical community figure out how to intervene early so that we know when children have these, what can we do now? And organizations like CASA are a big part of that, right? How do we pull in these extra supports to be able to help those adverse experiences not last into adulthood and really impact these kids in a negative way? Can you think of other traumas besides the ones here and besides the ones we've kind of already mentioned that the kids that you work with face?
This is David. I'm fascinated by the comments that you made about little T traumas.
Mm-hmm.
My most recent case had to do with, that really rang a bell for me, the idea of little T traumas. In other words, there's never any stability. It's always uncertainty. It's always, come on, let's go. There's never anything that sticks out. There's not abuse, and it's neglect in a certain sense, but it's just the total lack of stability, and the way that affects the development of the younger child, in my silly opinion, is insidious, and that's what I'm really concerned about with some of the kids that we take care of, that they don't even, it's not trauma with a capital T. It's not anything they can point to. They're just almost brainwashed with the idea of being put aside or neglected.
Yeah. Thank you. Thank you for sharing that. And, another thing that determines whether something becomes a trauma or not is just someone's personality and their sensitivity. So there are kids that, and sometimes this is related to early childhood trauma, right? But there are kids who are just more sensitive to their environments as well. And therefore they can pick up quicker on like stressors of adults and these kind of things. And those kids we typically see more in counseling, right? For depression and cutting and these kind of things. And those are so like, and if you have that kind of personality and you go through something that's hard, you might be more likely to feel it as traumatic than someone who has, a different type of way of being that maybe isn't as sensitive. So that's another thing to think about too. So I mentioned kind of in general that these ACEs can lead to, risky behaviors and these kind of things, but more specifically what we're talking about is increase in things like adolescent pregnancy, alcoholism and alcohol abuse, depression, illegal drug use, heart disease, liver disease. Why is that? That is linked to cortisol, which is the stress hormone. And when you're in this constant state of stress and that cortisol is being released all the time, there can be adrenal and a bunch of different things. And then that leads to these physical problems. Multiple sexual partners, they're more likely to end up in abusive relationships themselves, sexually transmitted diseases, smoking, suicide attempts, and unintended pregnancies. So we got a lot of things that could lead to a lot of challenges, right? If we're not helping these kids. And then, like I was telling you, the studies show that adults who have experienced childhood trauma are 15 times more likely to attempt suicide, 4 times more likely to become alcoholic, 4 times more likely to inject drugs, 3 times more likely to be absent from work, 3 times more likely to experience depression, and 2.5 times more likely to smoke. And then but 60% of adults report experiencing abuse or other difficult family circumstances during childhood. But what we know is, pretty much most people have had some kind of challenging experience, right, when they're younger. But where these statistics get worse depending on if you've had multiple, right? And a lot of the kids you see have probably experienced multiple of the things you have abuse and you have a neglect. You have your parents separated, or maybe someone dies, or you feel unwanted, or all these things kind of start stacking up. And then young children exposed to 5 or more significant adverse experiences in the first 3 years of childhood face a 76%. So that's huge. 76% likelihood of having 1 or more delays in their language, emotional, or brain development. Why is that? Because those first 3 years, your brain is doing so much, right? You're learning to walk, you're learning to talk, you're learning to attach or not attach if appropriate attachment is not available for you. So this is where the importance of early intervention comes into play. Used to, 30 years ago, people were still saying, oh, they're so young, they won't remember this. What we know now is even in the womb, if the mother is experiencing stress, their brain chemistry is going to change and their bodies will remember. So if a child that is pre-verbal is abused, or if they're in an abusive situation, they might not have the words to express it, but their body remembers. So since I specialize in trauma and sexual assault and domestic violence, I've had a lot of adults come into me and they're having some kind of symptom and they don't know what it's from. And then we do different therapy techniques, different trauma processing techniques. And some of them are able to remember things that happened to them when they were younger that they had kind of like blocked out of their mind, right? But their bodies were still responding to it because it occurred and they couldn't forget that. Okay. So we already talked about this. What types of traumatic experiences do the kids you volunteer with face? So what's the impact? We talked about like the impact of the ACEs. So the impact of child traumatic stress can last past childhood, like we just saw. learning problems, lower grades, more suspensions and expulsions, increased use of health and mental health services, increased involvement with child welfare and juvenile justice services, and then long-term problems like the health problems. So trauma is a risk factor for nearly all behavioral health and substance use disorders. So it says risk factor because it doesn't mean just because you've had trauma, you're going to have those things, but your risks are a lot higher. So that's why trauma has also been called a public health crisis, right? Because we have so many people experiencing trauma, and if they're not getting the help they need, it turns into a public health crisis. Okay. So here's just another one to show kind of all the different ways that it affects someone, their body, their learning, their behavior, their memory, and of course, their relationships. So these are signs to look for. So when you're, and who was it that shared? David, were you the one who shared, right? So, when you were talking about, like maybe the kids you work with they're not telling you like, oh, I went through this traumatic thing, right? But if you're seeing some of these signs, then you can know, okay, they're likely having some type of trauma, right? Or something in their life is feeling that way to them. And so I like this diagram, and I'm not going to read all of them. But hopefully, Mark, I didn't ask you this, like, because I have some stuff I'm going to go over and like resources so in case people want to like look back into it. Can I just send that to you afterwards so you can make
Sure.
that?
And I would forward it on to the volunteers
Okay.
through email.
Yeah. Okay. Good. Because there's going to be some things like this. Like, I'm not going to go through the whole thing, but I think it might be a good resource for you all as you're moving through, right? Depending on what age you're working with. But just for example, for preschool children, they might have a really strong fear of being separated from their parent and caregiver. Now, all preschool children have this a little bit, but we're talking about like more exaggerated. They might cry, scream a lot, not eat very well, lose weight. Sometimes we see regression, like, for example, a child might be potty trained and then they experience a traumatic event and then they start wetting the bed again, things like this. Having nightmares, recreating the trauma through play. And that's why one of the top therapy mechanisms we use when we treat trauma for children is play therapy, because especially children 0 to 5, their language is play. And so when we get training on working with trauma with children, a lot of times we do what's called post-traumatic play with them to help them process the trauma. Okay, now moving on to elementary school children, they also are going to have a lot more anxiety, fear, hard time concentrating. A lot of times this comes out, people think that they have ADHD, and I experienced this so many times when I worked at a community clinic. The doctors would refer the kids to me saying they have ADHD, we need you to give them this diagnosis so that we can give them meds and all of this. But then after I did my clinical screening, what I realized was, no, they just had trauma, right? And if we could, and trauma affects the brain in a similar way that ADHD does. So if we could treat that trauma, then a lot of times we could keep them off the meds and decrease those symptoms. But it can really come out in that hard time concentrating, difficult sleeping, changes in their school performance. And then when we look at middle and high school students, this is where we're going to see some of those acting out behaviors increasing. Say they have no feelings about the event, kind of acting kind of numb to it. These kind of things. Depression, feeling alone. So these are just some signs that you can look for. So now we're going to move into a discussion on trauma in the brain, because you may be thinking like, okay, why? Like, why do they have a harder time concentrating? Why are they more likely to be depressed? Well, because it literally changes their brain. So this is just a short video. It's 5 minutes, but I thought it was worth showing to kind of explain to us what happens in the brain. Okay. So tell me if you can hear this.
Brain development.
Can you hear it?
Yes.
Okay, good. All right, let's watch this.
Is much more than a story about biology. From the earliest years, relationships with others play a key role in shaping how our brain grows and develops. Early relationships, where there is abuse and neglect, have a long-term impact on children. A brain that has adapted to survive in a threatening or unpredictable world may not work so well in an ordinary environment. This can create what is called latent vulnerability, where early abusive or neglectful experiences with carers put children at greater risk of experiencing mental health problems in the future. For these children, compared to their peers, common experiences like moving to a new school can feel more daunting and stressful. New faces can appear threatening, while positive social cues can be missed. It can be harder to negotiate new social situations and learn to trust new people. Even fun experiences like joining a new sports team can be challenging. Too much focus on potential threat cues can mean missing out on positive social cues, such as a playful nudge. Or it causes an overreaction, which leads to an increased risk of conflict and sometimes violence. These reactions can increase the likelihood of generating new stressful events. It's harder to deal with everyday challenges when you feel unconfident and anxious inside, and harder to build and maintain relationships. Over time, this can mean a child loses friends and the support of adults, and so misses out on opportunities to grow and develop. This social thinning can increase the risk of mental health problems in the future. Neuroscience research is beginning to shed new light on how vulnerability unfolds over a child's life. All children need care and stimulation from adults who value them and who show them attention and love. These experiences shape a child's brain development. When children face traumatic experiences like abuse and neglect, their brain adapts to help them cope. We know of changes in 3 different brain systems: the reward, memory, and threat systems. Experiences of domestic violence or physical abuse can lead to hypervigilance, where the brain reacts more to threat. This might help a child stay safe in an early adverse environment, but it can cause problems in more ordinary environments. Hypervigilance can best be understood as a pattern of adaptation rather than a sign of damage. Abuse and neglect can also mean a world where a child's basic needs for care and attention are not met. This can shape the brain's reward system, the part of the brain that helps us learn about positive aspects of our environment and motivates our behaviour. Over time, the brain's reward system can learn to respond differently to things like positive social cues. Neuroscience studies have also pointed to changes in the autobiographical memory system, our memory of everyday past experiences. Following trauma, negative memories appear to become more salient, which means they become more prominent than positive ones, and everyday memories can also become less detailed. This is a problem because we need to draw on past experiences to help us deal with new social situations. Neuroscience research is showing how childhood trauma can create latent vulnerability, increasing the risk of later mental health problems like anxiety and depression. This vulnerability is not just located in the child, but arises through their relationships. Helping children who have experienced trauma still requires ordinary boundaries and consequences, but it also requires us to step back and reflect and see behaviour that we find challenging in a different light. A child may simply be doing their best to survive now, with brain adaptations from the past. We know a child's brain has the capacity to continue to adapt. For this to happen, they need our help to build and maintain trusted relationships, manage everyday stresses, and prevent new ones from happening. We need to encourage them to try again and believe things can be different. This is far from an easy task and takes time. Science is helping reframe our understanding of childhood trauma. Seeing children's behaviour in a new light can mean we respond differently. But there is much still to learn. Working together, we can develop more effective approaches that promote resilience and recovery. We can help children build trusting relationships and create opportunities for their brains to adapt in new ways.
All right. So even though that's a short video, it covers like a whole bunch of stuff, right? And so,
Love the diversity in it.
yeah, well, I wanted to hear your takeaways from it. Like, what did you notice? Um, I mean, it's from the UK, but it's relevant to all the things happening in Children Anywhere, right? Yeah, so these are the questions. What were your takeaways? What stood out to you as something that would be important to remember about how trauma impacts the brain of the children that you work with? Because I really like how the video shows like, the kids acting out and how like it's related to when they were babies, right? Like it's the same kid, and if the brain hasn't had other adaptations, it's going to come out in different ways as they're growing up.
Abbie,
Well,
oh,
go ahead.
this is Georgia. Okay, this is Georgia. Can
Hi,
you hear
Georgia.
me?
Yeah,
Hi.
I can hear you.
A couple of things. This social thinning. I've probably seen that more with the parents that we've dealt with, which is really interesting because they're trying to get their kids back, but they don't really have a community established to to support them or anything else. And and then the kids that I've seen, especially the school age kids, have a hard time establishing friendships.
Mm-hmm.
I mean, just playmates and stuff. So
Yeah, and
I
Georgia, you bring up a really good point to remember. People who end up having their children taken from them for abuse, neglect, whatever, those are traumatized children, right?
yes, yes,
Like
absolutely.
they're just adults that didn't get the support that they needed from their trauma, and
Right.
then they now are trying to figure it out, and then they also have these beings that they're also traumatizing, right? So it's kind of like a trauma sandwich, right? They've got their own trauma, and then they're doing things that is potentially traumatizing to their children, and so that's why it is so important to help them find support, like you're saying.
Yes. Yes, and my guess is that they don't really get this, they don't, and that worries me. I mean, if we're trying to get the kids back with their families, if that's not addressed for them, it just sort of scares me, what's going to happen once the kids are back, I guess, if that's not really been taken care of. So,
Right. And if they grew up in dysfunctional homes,
yes,
they
yes,
can't rely on, they don't have a natural support system just like from grandparents and, these kind of things if those adults were dysfunctional. So
uh-huh,
it takes even more work, I mean, that's one of the things we do as social workers, right? We try to make systemic change for these families where we think about all these issues. Because you're right, if we don't address that, sure, they can get their kids back, but when they don't have enough support and they're overworked and overwhelmed, who's going to help them,
right.
right?
Yes, yes.
Thank you.
Mhm.
Okay, somebody else was going to mention something.
This is David. I think I was going to jump in with what I noticed in the video about the young kids and reward system. In
Mm,
other words, parents they have all these kids, and then real early they neglect them in a subtle kind of way where they don't appropriately reward them for certain behaviors and so on, and so there's a certain confusion that sets in on the part of the child. That's what I got from the video.
thank you. Right, and they
I
might
wanted to think.
and they might be in a situation where they're actually getting more rewards for negative behaviors, right? Depending on what kind of situation that is, or just not any kind of feedback. Thank you. Okay, so I like to use this image um, to explain. Has anyone ever seen this before? It's the the tolerance window. Okay. So like where you see the blue jagged lines and where you see the yellow line in the middle, that's the resilient zone. And you can think about this in your own life too, because none of us, whether we've had trauma or not, can be in our resilient zone all the time. Okay. Obviously, that's ideal because when we're in our resilient zone, we can face challenges and we can better be able to know how to handle them. But when you have some kind of traumatic thing that occurs, okay, you can get stuck either on the low end of the resilient zone where you experience depression, sadness, isolation, exhaustion, fatigue, or in the high zone where you're irritable, manic, anxiety, panic attacks, angry outbursts. And people who experience trauma, if they don't get treatment for this and don't have extra support, they often are not in the resilient zone much time. Like depending on how much trauma they've had, and how much lack of support they've had. I mean, I've had clients that literally, if we think about a day period, they're probably in the resilient zone, like, 2 to 5%, right? They're either under it or above it. And so what we do as therapists is we try to teach people coping skills and bring in supports and all these kind of things to help them get in the resilient zone. But you, even though you're not trained as therapists, you can do small things to help kids kind of come back to their bodies when you see them get out of those zones of resilience, right? So has anyone worked with a kid where they've felt like they've either been above that resilient zone or below that resilient zone? Can you think of an example of a behavior you've seen or something that where they're kind of out of that zone?
I did work with one young man. He was roughly 13. And basically, the first time I met him to see the kids, he wouldn't sit still. I mean, he was running everywhere, didn't want to be a part of the conversation. Um, and then over the course of visits, I mean, that comfort level, as far as the visits go, he would talk a little bit longer. And it wasn't until like a full year later that he could actually sit down and have a full conversation with me.
Yeah.
So yeah, there were a lot of times when he was, edgy and just didn't want to be there.
Right, because his body had probably been trained to stay alert, right? Because of whatever trauma he had experienced. Thank you. That's a good example. Okay. So why does it impact other ways that it can impact health? I already talked about this a little bit. It increases the stress hormones in your body, which affects the body's ability to fight infection. It increases difficulty in making friends and maintaining relationship, increases problems with learning and memory, which can be permanent, which again is why the earliest intervention we can get, the better, lowers tolerance for stress, and then reduces the ability to respond and learn in school. So what can we do to help? We're going to cover more of these at the end, but here's just some, when we're thinking particularly about the alarm system. So they went over that in the video. When kids are, really kind of outside of that window, one thing to do is to help them recognize what's activating that system in their body. It's because kids have different triggers. So helping them understand what their triggers might be. Helping them decide whether there's real trouble or not. Because sometimes, our bodies are on so high alert, like the example they gave in the video, those girls were actually not a threat to that little girl, right? They were actually giving her a toy, but her brain and her body saw it as a threat. So sometimes as adults, it's important to help kids kind of decipher through, were they really in danger? Or is that kind of their brain just signaling that to them? And if it is, they need help, of course, seek it from a trusted adult. Practice deep breathing and other relaxation methods. So two of the most common ones that I use with my clients, but can be helpful to anyone. And some of you might do these, especially if you've taken a yoga class or anything like that. One that's really good to explain to kids is the box breathing, where you inhale for 4, You hold for 4, breathe out for 4, and then pause for 4. It's called the box breath because, 4, 4, 4, 4, it's kind of to help people remember. But just doing that can help people like calm their system. So again, in the case of that little boy, the first few times you met him or whatever, maybe he was so activated that he wouldn't have been able to breathe at all. But maybe after working with him for a while, you could practice, like just see if he could take 1 breath with you, right? Also, something if box breathing is too complicated for people, literally just telling them to exhale longer than they inhale. We know from studies that that signals the body that you're safe. So if I'm inhaling for 4 and then I exhale for 8, that is going to signal to my body that you're in a safer place and to help the parasympathetic and the sympathetic nervous system to like calm down. So that's one you can actually try on yourself if you haven't ever tried that. If you feel yourself getting anxious, agitated, just exhale longer than you inhale. And it doesn't have to be 4 and 8, but just, something that's longer and that can help calm down. Are there other techniques that you all have used to help your clients calm down or even calm yourselves down that you think might be helpful for kids that are experiencing trauma? Okay. We'll go over some more things that we can do in the end. I'm going to zip through this because I know this is getting a little bit clinical, but I did want you to have this information because when children come into therapy and they've had traumatic events, we give them certain diagnoses, right? In order to be able to treat them and bill for their services and all of this, and to just understand what's going on with them. So these are 3 that we see often. Reactive attachment disorder, which is usually related to attachment and their inability to attach. And so a lot of times, whoever their main caregiver is, they'll kind of resist attaching to them, and the behaviors can be very scary. Disinhibited social engagement disorder, so they have a hard time engaging with others, and then post-traumatic stress disorder, PTSD. So I'm not going to go over like the actual diagnosis criteria for each of these, but just know if kids ever talk about these or like they're diagnosed with these kind of things, that's what they're talking about. And PTSD, so acute stress disorder is a symptom. They have PTSD-like symptoms, but it lasts from 3 days to a month. So a lot of times right after a trauma occurs, someone will have acute stress disorder, but if we can intervene early in that month after, if they can get the support they need, if we can help calm their nervous system, then it won't turn into PTSD, because then the diagnosis for PTSD is if the symptoms have lasted a month or longer. Okay. All right. And when we are, and I've mentioned this a little bit throughout, but when children receive therapy for PTSD, one of the things that we help them do is process and integrate their trauma. And there's a variety of ways that we do this. I mentioned play. We help them figure out how to control the physiological reactions that their body goes through. So like when they feel those anxious feelings, what can they do? And then reestablishing secure interpersonal relationships. This is super important because most children, I would probably say all children that have experienced some kind of abuse and neglect, especially the ones that it's someone they know, they've had some kind of attachment trauma. And so it's important that they have as many positive, supportive attachments with adults in their life as possible. And again, that's one of the main things that you all do that's so great for their healing, right? If you can be another one of those positive adults in their life, even if it's just short periods, that's meaningful. And that research shows us that can literally help rewire their brain to be more securely attached to people in the future if they can have this with some adults when they're younger. Okay. So yeah, so we use cognitive behavioral therapy, we use cognitive processing therapy, support groups, EMDR, which is eye movement desensitization therapy, and then the number one that we use with children is play therapy. And then and then I have a whole section on attachment theory. And the point I want to make about this is that and this goes back to what Georgia was saying about these adults who are struggling with attachment, right? Like they don't have people they're attached to and they're connected with, because when you have these kind of adverse childhood experiences, a lot of times you don't securely attach to your caregiver. And if you don't securely attach to your caregiver, or if you have an insecure attachment or an avoidant attachment, then this impacts all of your future relationships. And you can repair that. I mean, I work with adults all the time who have been abused as children, and they don't get treatment until they're adults, right? And they've had a lot of trouble with relationships, and we can work to repair that. But if we can understand that and help children with that, the earlier, the better. Okay. I'm just looking at our time. I want to have more than less because I didn't know how fast I was going to go through this, but I want to make sure we get to the activity at the end. But the good news of all of this is that children can and do heal. So resilience, right? There's two kind of terms to think through. Resilience, which is the ability to return to being healthy and hopeful after bad things happen. And research shows that if caregivers and adults provide a safe environment for children and teach them how to be resilient, that this can help reduce the effects of the ACEs. And another term that I don't have written down here, but that you'll see if you read about this, is called post-traumatic growth. And that's the idea that after a trauma occurs, if people get the support that they need, they actually can become more resilient, right? Because they've been through something, they've shown their body, they've shown their brain, hey, I can face this hard thing and I can survive and I can actually be stronger on the other side. And so that's called post-traumatic growth. And that's really what we want to support in these kids. So what can we do? Parents, teachers, caregivers, you all can help by first understanding what are these adverse childhood experiences that your clients, the people you work with face. Having this training is one of the steps, right? Helping children identify their feelings, managing their emotions, and creating safe physical and emotional environments at home, in schools, and in their neighborhoods. Because depending on how wounded their parents might be, the reality of it is that their home may never be a safe place, right? But how can we counteract that? By helping them connect with places in the environment, in the community, in their school, sports teams, any other thing we can connect them with, whether it might be church groups, right? Things to give them that extra support so that even if their home environment is not safe, they have some spaces in their life that are safe for them. There's a video that I'm going to give you a link to that's really good. It's an older video, but the reason why I linked it in the resources is because it has Bruce Perry, Daniel Siegel, and Marty Glenn, which if you look at any books or they're kind of like the trauma gurus for children. So they have there's a video that I linked called Trauma, Brain, and Relationships. And it talks a lot about developmental trauma and how it can be more common to catch hypervigilant kids and babies that are traumatized, like those that are kind of acting out, screaming more, showing these signs externally. But it's also important for us to remember that some kids shut down. And that doesn't mean that they're less traumatized. It just means that it's kind of going internally. So in order to help, especially young kids, we need to help their parents, help their families, and become sensory detectives. So we want to increase the comfort sensory-wise for these young children. And so do they need different toys, different music, different things to make them feel more comfortable? And so trauma changes the brain, but so does connection with others. And that's really the biggest thing I want you all to remember of how important your role is in these children's life, because these positive connections you have with them can literally rewire their brain. I also have a link to a book by Dr. Elena Gill. She is the one that talks about post-traumatic play and how to use play to help children heal. So again, when we're talking about resilience, what does it look like? We want to try to help them have resilient parents. We want to help the parents to be resilient, right? And that might not always be possible, but we want to build attachment and nurturing relationships by having adults who listen and respond patiently to a child in a supportive way and pay attention to a child's physical and emotional needs. That's where you all can come in. Help them to build social connections. Making sure their basic needs are met. For any of you that have taken a Psych 101 course, you usually talk about Maslow's hierarchy of needs, which is the idea that if you don't have food to eat, if you don't have clothes, if you don't have access to education, if you don't have your basic needs met, then of course you don't have the energy to deal with your trauma. So we want to make sure these kids have that. Help their parents learn about parenting and how children grow, and then help children interact in a healthy way with others, learning how to manage their emotions and communicate. Okay, so what I want you all to do is I'm going to put this link in the chat, okay? Because go to this link and where's the chat box? Okay, I'm gonna have to stop the share so I can see the chat box. All right, I'm gonna put this link in here. And it's gonna take you to this document right here, okay? Or, and if we don't have, we're not gonna have tons of time right now because we only have 5 minutes left, but I thought this would be a really good resource for you because you all particularly work with foster parents and you work with foster children. And so these are trauma responsive practices. So this is adapted from helping children heal through trauma-informed parenting from the National Child Traumatic Stress Network. So it's broken into different categories, and some of these might not apply to you. Like you might not have much control over what is going on in someone's home. Can you see my screen? You can't see my screen now. Can you? I'm sorry.
No.
I'm going to go back. So what you should be opening up, and you can just look here for now because we're probably not going to have time for you to look through it on your own, but I want you to have this resource, and it's also in my, my resource references.
Don't stress on time. Don't stress on time. You're fine.
Okay.
If we run over.
All right, we can run because this part is really important because I really want you all to have some takeaways from this. So you'll see here, it's broken into categories. So in the home, again, this one you might not have a lot of control over. But if we go down under the resilience one, what I would encourage you to do is on your own, go through these and literally highlight the ones that you think you could incorporate in your work with kids. Okay, because there's got to be at least one or two that you feel like you might be able to do. Like example, respond, don't react. Your reactions may trigger a child or youth who is already feeling overwhelmed. Some children are even uncomfortable being looked at directly for a long time. So just remembering for you to stay calm, right? No matter kind of what they're telling you or what's going on, because they may even be more hypervigilant to how you're reacting because they're already traumatized, right? And like we saw in the video, you might be doing something that in your head, you're thinking, well, I'm trying to connect with them. And they might be actually taking it as a threat. Right. And that doesn't mean you're doing anything wrong. But it's important to just remember that so that you can not overreact, right? Okay. And then if we move down, you've got relationships. This is another one I think you could find some when I was talking about, how do we build these positive connections with them? This one's going to have some tools for you there. Then education and advocacy. How do we help? Is there anything that I don't know how much you guys are involved with the schools, maybe not at all, but is there any way we can advocate for their school environment to be more helpful to them? If you're noticing problems in school. In the courts, I know you all deal with the courts, right? So this gives you some ideas of what to do to support them in the court area. And then I felt like these could be super helpful, especially for those that aren't, trained as counselors and whatever, ways to communicate in a trauma-informed tone and manner. So you want to open a lot of, you want to reflect on what you're seeing,
Right.
but not necessarily, and kind of ask open-ended questions, and not in a non-threatening way, right? In a trauma-informed tone and manner. What has happened to you? What do you think? What can you learn from this? What can we do to solve this problem? I see you are confused. I can hear you are frustrated. That's a really good way to, especially kids that are having trouble expressing it, right? If you see, like, your face is showing me you might be upset. Are you feeling upset? And you can even ask them, right? Just so that they know that a lot of kids, especially if they haven't had appropriate mirroring and attachment, they haven't had many adults notice that they're in distress. And so you just noticing might feel awkward to them, but it's going to be meaningful, if that makes sense.
Makes a lot.
So I think this might be your biggest helpful tool moving forward if you're taking some time looking at this, because I wanted you to have just a few tools that you felt you might be able to refer to. I also have at the end of the presentation, let's see, from current slide. I've got kind of key websites that I got most of my like statistics and information from, the books that I mentioned. There's a PDF on resiliency, and then that one that I just gave you is the PDF trauma responses practices for foster parents. And then these are the two videos. We watched the childhood trauma in the brain, and then if you have time, I encourage you to watch the one with the trauma experts that talks more about developmental trauma, especially those of you that work with younger kids. That video could be super helpful for you. Okay. So there's so much, the good news is there's so much information now out there about children. This was actually children and trauma. This is actually quite challenging for me because it's really hard to decide, what are you going to cover in 1 hour that could be helpful, because there's so much research now on it. But I do hope there's been a few takeaways. Are there any questions that you all have?
Abbie,
Yes.
it's Georgia again. I guess my biggest concern, I mean, the kids I'm dealing with now certainly have seen trauma, and are, they talk about it, and so sometimes I see behaviors, especially in the little second grade boy, but as the mother of two boys and two grandsons, I mean, when do you think it's just typical development? Little boys figuring out what's going on. I mean, how do you know the difference between that and a they're having traumatic responses or whatever? I don't know if I said that right, but
Yeah. Like a lot of second grade boys might have aggression, right?
right.
They might deal with not putting their hands on people, and that's maybe just a lot of second grade boys deal with that in general, right? But
Right.
typically, if it's a trauma response, let's just take that for an example.
Yeah.
It's going to be more intense. It's going to be harder for them to control it. And a lot of times, like normal things that adults are trying to do that some kids are responding to, like they are probably not going to be able to respond to as well, right?
Uh-huh.
Like you might, at school, they might be giving him consequences or things like that, but that's not stopping the behavior, and like watching, and especially if you already know that he has been experiencing trauma, like usually it just looks a little bit different in like the way that they enact this kind of stuff. Like, can you give me an example for that one that you're working with? Like, what kind of things are you concerned about? Like, is this normal behavior, or might this be a traumatic response? Can you give me an example?
Well, I am sometimes with them when they visit their mother, and it seems to be a mom thing, but he's very competitive, and when he doesn't win, I mean, and I know, I mean, boys and girls get that way
Mhm.
sometimes, but it to me, it seems problematic. And, I've tried to talk to him about it, but he overreacts and he gets very emotional, and he's a pretty sore loser. And
Yeah.
that's just one example.
Yeah, yeah, definitely. And so you're seeing him out of that resilience zone.
Yeah.
Right? Yeah, and having trouble kind of bringing himself back to that zone. So it
Yeah.
sounds like for sure, depending on how intense it is, right? That definitely could be a trauma response that he needs, more support to know how to deal with that and be able to maintain it. And it could be if it's happening around the mom, depending on what kind of relationship and attachment they have, it's serving a purpose.
Yeah.
Even if it's a like negative purpose, if that makes sense.
I gotcha.
Yeah. Thank you. Good question.
Would you say the same thing about ADHD symptoms compared to trauma?
Yeah, I mean I think that would be very hard for you to screen out just on your own, right? Because like I said, like most of the kids that I worked with that come in with ADHD symptom, they have some kind of trauma. Now, that doesn't mean that every kid that has it doesn't mean that a kid doesn't have ADHD and trauma as well, right? Like they can have both, and it can be that the trauma is exacerbating the symptoms, or it can be that they really don't have ADHD and it's just trauma, and that kind of takes clinical training to be able to kind of parse through, if that makes sense. But regardless of whether they have ADHD or not, these symptoms of having trouble concentrating, just struggles at school in general and all of that are going to be definitely related to trauma.
Okay.
And so, yeah, I mean, ideally, every kid that you work with, I would want them to be working with someone who's trained to do trauma therapy, right? Now, I know they don't all have those resources, right? Which that's why you guys are so key, because they might not have those resources available to them, but what you do is still important. Even if you don't know the actual interventions to do with them, just doing those things on that list and being that supportive person is still going to have some impact in how they're acting. Well, again,
if we have time, what
Oh.
about the idea on treatment and counseling, and then recurrence of the trauma then later on in life?
What did you say?
Okay, so basically, I'm sort of drawing off of a few volunteer applicants that we've had.
Okay.
That they had experienced trauma earlier in their life, and they had gone through counseling, but then when they came to us and said, I want to be a volunteer, something in the training stirred up old memories and caused more trauma. So
Yeah.
I don't know if you want to talk about anything on that.
Oh, yeah, I think that's a great point. I mean, what that is signaling to them, if they're willing, is like they're being triggered, which means they still have work to do, right? Like it doesn't necessarily mean that they can't do the work with other people or whatever, but I would suggest that they are going to have to do more of their own work, right? Like if whatever they've worked through, if they're still being triggered by what you all are talking about, or if that still feels traumatizing to them, then I think that's just a sign that there's more healing they need to do on their end. Does that make sense? And some people might be willing to do that and some people might not. It depends on their readiness and willingness, or some people might be in denial about that. Like, be like, well, I already did the therapy. Like, I'm fine now, But if they are experiencing it in the moment and being re-triggered, then there is still something there that's not quite worked through, right? Does that answer your question?
Pretty much. I don't know, it's a situation where the therapist says, well, you're cured, go out and live your own life. If a therapist were to say, I think they got some problems, but they don't want to talk about it, or they appear to be cured type situation. I didn't know how all that filters in.
Right. And I mean, for anybody that's done any kind of emotional work or therapy work or spiritual work, like it's never completely done, right? Because we're so complex and things are always evolving. And just when you think you've peeled one layer from the onion, it's like, yeah, something else can trigger you kind of out of the nowhere. And then it's like, okay, that's another opportunity for me to look at this and to move through this. And so, yes, of course, as therapists, our goal is not to keep people in our offices forever, right? We want to empower them and get them to the place where they have the skills to be able to deal with those triggers when they come up, so they're not having to be in therapy their whole life, right? But there's different levels of what people are willing to do or their ability to do that, and like, you know what I'm saying? Like how that's going to impact them as they're moving forward. But thank you all for your questions, for your comments, for your work. I'm glad that I got to talk to you tonight. I hope something I said was helpful. I'll send my resources to you all, and hopefully, yeah. Let me know if you have any questions. I'm at SEMO. Oh, you know what? I don't think I put my email on the
I could share it.
yeah, you can share my email and all of that, and I can be a resource for you in any way that I can.
Wonderful.
Thank you
Yeah.
so much.
So basically, yeah, I will send the link for this video to all the volunteers, and actually you'll get a copy as well. So your email will be attached to it, and
Okay.
all that.
And then do you want me to just email you my PowerPoint?
Sure, if you want, and I can share that as well.
Yeah, because that has the resources, and if people want to watch that video or whatever.
Right, and as well as, there was several slides that you kind of glanced through. If one of the volunteers wanted to take a little bit more time and read all through the ones that, were just kind of glanced over, that might be beneficial to them as well.
Yeah, for sure. Yeah.
Okay.
Yeah, I mean, if you want me to go back through those, I can. I just thought we had
No,
a
no, no,
6.
no,
I thought we
no.
had a 7, so I was like, I just want to make sure we get to the takeaways.
No. And they're okay with getting a few extra minutes for the
Okay.
credit. I mean,
All
I'm not
right.
gonna say, well, we were there for, forever and you only get credit for an hour. No, we don't do that. So they
Okay.
still get extra credit for all this. So and actually what I may add on, for those that are watching at the moment, um tonight's going to be worth an hour and 15 minutes. And if they want to watch the video, that'll be another 15 minutes I can add into this for this evening. So,
Well,
um,
because I think the video is like, I don't know, I can't remember. It's like I think it's like 30 minutes. It's
oh,
pretty.
wow. Well,
Yeah.
they will get appropriate credit
Even
for
better.
that.
Yeah.
Yeah. Yeah. They'll get, yeah. Okay.
Yeah.
George, you have something?
No, I just thank you, Abbie. It was very interesting.
Yeah, I know. I wish I could meet you all in person, but I'm glad we at least got to, do this virtually and get together, and good luck with all your work.
Thank you. Okay.
Bye.
Thank you.
Okay. So Georgia, David, Alan, and Bridge, I will get your credit into Optima. You don't have to worry about writing up anything. But then if you do go ahead and watch the videos that are attached, then you'll need to let me know to give you that appropriate credit. So definitely thank you, Abbie. I will send you another thank you through the email as well. Wonderful program. I wish more people had been online to ask more questions, but it is what it is. So I will bid everybody a great evening then.
Bye.
Good night.
Thank you. Thank you. Thank you.
Thank you.
Excellent.